called the doc. Doc said, hey, go to the emergency department. He went to the ED, was treated, and has now been admitted to the acute care floor. So he's not in the emergency department, but he is in the hospital, and he has a history of asthma. His orders are to titrate supplemental oxygen to keep a SAT greater than or equal to 90%. Okay? And he also has an order for Q4-PRN, albuterol, 2.5 milligrams, to be administered via small volume nebulizer. Okay? And so here he is. A couple of things about the monitor. In order to see things when you start, you're going to have to touch the heart rate to get the heart rate to come up and hit start on the, so we attach the cup, we touch this, and then there'll be a start button that'll tell you to, it'll cycle the blood pressure so you can
Do
actually
we
see
have a
that.
pulse ox probe?
So the pulse ox probe is here, and it will give you data once you put it on.
So, Scott, a question.
Yeah.
I mean, we have our orders. You said there was gonna be kind of a chart.
Yeah.
There's spaces on there for us to fill out information that we find out during our assessment.
Correct.
But when you go into a room and assess a patient, you don't sit there with a clipboard and be like, oh, blood pressure, you know.
I know, but
normally-
this is gonna be our scenario, and let's just focus
Are
on
we,
what.
but I mean,
Yeah.
are we,
I'm going to allow you to write stuff down.
Yeah.
okay.
We
Yeah.
have
Okay.
we have a piece of paper students do take into the room. They can
Okay.
write their vitals and stuff.
As long as you're not putting any patient identifiable information
Right.
on your
Information,
scratch
you can
paper.
do that.
And
I
you're
just
not,
didn't know if in this scenario, when we do it for the test, if we were gonna
I do not,
get,
I do not expect you to keep everything in your head. You can write down notes.
Yes.
okay,
Yeah.
cool.
Okay, so I will be behind the curtain.
All right. Just finished my lunch break.
So Nero has been called up to the room because there are new orders on Mr. Dumbledore.
All right. So I'm just gonna check my orders. I already got the history that Mr. Dumbledore is a 69-year-old guy with history of asthma. He's admitted to the emergency room, and he is having, after a cold, he's having shortness of breath, and he is wheezy. So I'm gonna go and put my gloves on. And I already did my hand hygiene. Okay. I'm gonna verify my orders and see what my MD orders are. I'm supposed to keep my SATs greater than 90%, and he is slated for Q4 albuterol treatments, 2.5 milligrams via nebulizer. Okay, so I'm gonna go in and go knock knock.
Oh,
Hi, how are you, Mr. Dumbledore?
oh, I'm feeling pretty short of breath, actually.
I'm so sorry. I'm new from respiratory therapy. I'm your respiratory therapist for today, and I'm gonna take care of you and see what's going on.
Well, okay.
Okay, so let me just put this pulse ox to see what your oxygen level in your blood is in the meantime. So I'm just gonna listen to you. Okay. It's gonna identify your, I checked his label, his date of birth, and the, so your name is Mr. Dumbledore?
Yep, I am Albus Wilfred, I forget all of them, Percival, Dumbledore, something along those lines.
And your date was, date of
uh,
birth was
May 1181.
Okay, seems like your oxygen level is a little low right now.
That's
I'm gonna put
1781.
you on some supplemental oxygen. Little nasal cannula right here. I'm gonna put this on your nose for now and see.
Oh, that feels a little tickly.
I know, it's really the gas, the oxygen can be really dry. So,
Cool.
gonna put this in your nose and try to take some nice deep breaths for me.
Okay.
I know. I'm sorry you're not feeling well. So in the meantime, gonna listen to your breathing and hopefully your SATs will pop up. Oh, wow, you got some pretty wheezy lungs going on.
Cool.
start you on some treatment to make you feel better. Okay, got my nap. I'm so used to having things so close by. So,
Yeah.
yeah, 93%. So, what are you planning for the holidays?
Well, as long as I'm feeling better, I was gonna go over to Hogsmeade and hang out with my friends.
Hugs.
Oh, is that
The,
true?
Drink some butter beer.
Have some butterbeer at the Three Broomsticks.
Oh, that sounds like a good plan.
Sounds magical.
Let's get you there. Let's get you all there to go there. Okay. Alright.
That's awesome. Oh god.
Let's get you all there. Okay, so this is called albuterol, which is a bronchodilator treatment, which is going to help you open your lungs. So let's put this on. So in the meantime, while I was listening to his breath sounds, I counted his rescue rate, which is about, I would say, 28 about, and then
Good.
I have my nap going, and
There's a couple of funny things about the monitor here. So if we hit this, it'll
Yeah.
start giving us a number there, and then if we touch this, then
Okay.
it'll start, it'll give us a blood
okay,
pressure.
so in the meantime, I'll document his heart rate, his SATs. He's on a 4-liter nasal cannula, and he's getting his nap treatment. And I will see for any changes if his heart rate was it baseline 93%.
Yeah, that hasn't changed.
Yes, so that hasn't changed. His stats are getting better. And I'll ask Mr. Dumbledore, how are you feeling? I'm about 10 minutes into treatment, and I'm going to ask Mr. Dumbledore, how are you feeling right now?
It's a little better.
Okay, let me listen to your breath sounds and see what's happening. Oh, much better. Yes. I don't hear any beezes. Sound way better. How are you feling right now?
Better than when I started. Thank you.
Great,
Yeah.
great. So
That
we'll
must be
just
magical.
magical, mystical
Yeah.
one day. We'll just finish this treatment and then we'll see how it goes. So, yeah, I got my nap going. Come on.
Hey,
To-
so I've
to the
been
three
lying here
sticks.
staring at the ceiling. I know there's a TV over there, but I can't see it. Does this bed move?
Well, I can put the head of the bed up for you.
Oh, I didn't even know it goes up. That'd be great.
I can
Thanks.
put the head of the bed up for you, just to make sure. Is this comfortable enough?
Oh, that's better. Oh.
Oh,
yeah,
there you
that's
go.
better.
And let me
Oh,
find you the remote, and you can watch
great.
Sports
some
Center.
TV. So
I
there. in the
heard that
meantime.
the
There you go.
Quidditch World Cup is coming on.
Gonzaga,
That happens tonight.
they're rocking and rolling.
Yeah.
So I don't want to make it more complicated. I'm just looking at his blood pressure.
Oh,
Yeah.
don't worry about it.
Okay, so.
He has a history of hypertension too.
Okay, yes. All right. And if there's a clock in the room, if you have a clock, then you can count the respirations while you're looked at, so you know recording the pulse.
And there should be,
Or you can have your watch on and go.
there should be a clock with a second hand.
Second hand in the
sim
room, yes.
rooms. I think that they have those there.
Should be or will be.
So Scott,
There
are there
will.
any
Okay.
tips from the trenches about respiratory rate? Because that's the one thing I always have
Well, the
trouble
thing
with.
for you guys is,
See.
I think it's very important that you count and be diligent about counting it for now to begin with, and then during the course, maybe change things, right? Do you do a 30-second, or do you do a whole full minute?
I tend to do 15 to 30 depending
Okay,
on what the
so-
patient looks like.
Yeah, so-
Tips.
Because I mean, we're not supposed to stare at them because that influences their breathing,
Well,
right?
don't
So we
stare
kind of
at
have to.
them in
Well,
their
yeah, but I mean,
eyes.
right. But I mean, we
Yeah,
have to
yeah,
kind of
sure.
like use our
stand
peripheral
right
vision
here.
and.
And in the meantime, I'm always like picking things up and making sure every, room, just, ask
Yeah.
them a couple of questions. If they can complete sentences, that's a good thing.
I just kind of change my vantage point. I try to
Yeah.
find a spot on the chest that looks like it's moving pretty well.
Yeah.
And then I try to be kind of secretive about it.
Right.
What if, I mean, when you find that position where you're noticing the chest rise, and then you essentially watch the monitor, and you know,
Yeah,
you're observing
Yeah.
the monitor,
Yeah.
you're like, I'm just gonna check, see how the
Yeah.
stats are rolling for,
Yeah.
or going
And then-
for you, and then you can see the chest doing its thing as you're looking
Yeah.
at that television.
Yeah,
that's fine.
you can do that, and you can ask them some questions. Some
Yeah.
people like to talk, and they're a little chatty if they can tolerate that, so. Alright, so I guess almost done with the treatment here. We're almost done with the treatment here.
Okay,
Alright,
sounds good to me.
okay.
I don't know why that doesn't want to run in that particular position, but
Okay, so. I'm gonna assume that my treatment
That's
is
fine.
done. Is that okay
Yeah,
with you?
yeah,
All
yeah,
right,
totally
just gonna
fine.
take this off and. There's two things you can listen to. There you go. Sorry you took your, almost cut your neck short, but sorry. So just gonna listen to your breathing one more time, things are.
Heart rate's coming down.
Well, my breath sounds changed. Can you take a nice deep breath and cough for me? Wow. There you go. All right. Because.
Just bronchospasm.
Okay, let's see. Did you let me see? Oh, there's some green sputum coming out or some sputum coming out. Good. God, that eye thing was freaky. It was like a pterodactyl.
What is, what you,
I'm going for like a minute and a half.
Yes, your radiation
It's
sounds
like
more.
me.
Everything sounds good. How are you feeling?
much better,
Oh,
thank you.
good. Let me see. Your sats at 95. Let me see. You're 4 liters. If I can wean you down a little bit, wean your oxygen, see how you're doing. Okay, so I want you 2 liters and see how we do here. Stop blinking your eyes.
staring at.
Okay. And my doctor's orders were to keep my sats greater than 90%. Well, let's see if I can wean him a little better. Is he in the ED?
No, he's on the acute care.
Okay. Let's see how we're doing right here. Oh my God.
He
CT
just
scan.
stroked.
Are
He just
you-
stroked out.
Well, no, I was gonna say, are you flirting with me, Mr. Dumbledore? The wink, the
Mr.
wink.
Dumbledore, that's not appropriate behavior.
You getting fresh?
I'll have to tell you what happened with one of my patients now. Let me finish the assessment. All right, here you go. How are you feeling?
Took the oxygen away.
Much better,
Much better?
yeah.
Is there? Let me see. I'm gonna wean you down to Romer and see how things are going right now. Just gonna keep Denise account on for a few minutes. I know it sounds a little squeaky when I don't know why,
It's
but that's
okay.
just me.
Oh, we're DSAT.
93%. Yeah.
So we wanna keep it up, huh?
So we wanted to keep our sat. Yeah, I think we'll just keep you on the oxygen for now. Just bump you up to 2 liters. You're not quite ready to get off that, so there you go.
Troy.
Chasing the sad.
All right. Okay.
So
So is there anything else I can do before I leave the room?
Well, the doctor said starting tonight I was able to have a regular diet. I was wondering if you could find out what was for dinner.
I
don't know.
sure can
I'm
find
pretty
out for
hungry.
you. So,
Oh.
yeah, so I think we'll just, yeah, I can do that for you. And also, we'll come and see you in 4 hours to give another treatment just to make sure that you're doing okay with your breathing. Okay?
Sounds good, thank you.
Okay. Have a good day, Mr. Dumbledore.
I will do my best.
He was so freaky. He kept on winking at me.